Sheriff, as opposed to many police departments throughout the country, does not yet have robust use of body cameras and does not have enough mental health support so that there can be a co-response between police and social work, because so many of the frustrations and the emergency calls in our communities are not singularly crime or singularly mental health, but a combination of the two. And one of the things that we just discussed is the importance of co-response and even sequential response, so that when law enforcement goes to a crisis, they can de-escalate and handle the crime part first, and then have social worker address the underlying problems to prevent crime again in the future. I have been hearing about both the importance of body cameras for exonerating and for accountability, and the importance of social workers for several years now. I've been out on the beat with police officers, listening to some of their frustrations, what they encounter in their daily lives, and these two themes have come up again and again. And that is why, when it was time to decide on projects that we would put specific dollars into, or congressionally directed funding, this was one of the ones that absolutely rose to the top, was that we could take dollars from the federal budget and direct it specifically to what law enforcement needs most, which is the co-response capabilities, making sure the right people go at the right time to the right situation and do it together for safety, and to have body-worn cameras. These projects each have gone through the committee process in the House, made it through our office with $1 million of funding each, got full funding from Appropriations Subcommittee and Committee, and now will come to the House for a full vote and then get merged with the Senate. I know that there are many steps along the way to get things through the finish line. One of the things that gives me a ton of hope is that this last year we were able to get every one of our community projects funded. And I can tell you how important this is to our communities, because we are struggling with public safety right now, and we are all deeply frustrated by crime. And our police officers, our law enforcement officers, need to have all of the tools that they need in order to police, keep our communities safe, and make sure we get the right resources at the right time. So in the spirit of keeping communities safe and making sure that we have all the tools and training and resources we need, I'm going to hand this over now. I'm going to thank all of our law enforcement, and I'm going to hand this over to Executive Dow Constantine. Thank you.
Well, thank you, Representative Schrier. We so appreciate your partnership, and as Representative Schrier mentioned, we just wrapped a what I thought was really fascinating roundtable discussion with several of our law enforcement officers, as well as a mental health professional who works alongside the officers to diffuse situations and get people the help they need. And we discussed, among other things, the importance of body-worn cameras and that co-responder model that involves a behavioral health professional in the field with our officers. Building trust, transparency, accountability are paramount to the engagement between law enforcement and the community. And both of these tools, the body-worn cameras and the co-responder model, help ensure that we have the ability to do all of that while responding to a wide variety of needs. I'm going to let the sheriff and Major Bo, who's I'll refer to as chief as well because that is his role in the city of Burien, speak to the direct impact and effectiveness of both body-worn cameras and the co-responder model. But I want to say that the health of our communities depends on the ability of every person to be able to live a safe and productive life. We are all owed that. And folks need to know that when help is needed, when they pick up the phone and call, help will be there for them, and the right kind of help. If we're to truly enhance how we deliver public safety to keep our communities safe, then we must create an approach that is reflective of our values and brings genuine safety to communities and to do that with the actual partnership of the communities we serve. Now, thanks to the hard work of Representative Schrier in securing federal support through the community project funding, the King County Sheriff's Office will in fact have the resources to be able to move forward more quickly with these important innovations. So we're tremendously grateful, and I have to say, on a personal note, I was tremendously impressed by the amount of direct personal involvement that Representative Schrier has had in going into our communities and seeing what's going on with crime and with people who are facing challenges, and identifying the ways in which our federal government can direct its resources to help us locally engage communities and create that genuine community-based safety. It's my pleasure to introduce to you now the Sheriff of King County, Patti Cole-Tindall.
Thank you, Executive Constantine. Good morning. I am Sheriff Patti Cole-Tindall, and I'd like to welcome you to the city of Sammamish and our Precinct 2. It's from this location that we direct law enforcement work in our north and east parts of King County, a major piece of the 8th Congressional District. I want to thank Congresswoman Schrier for her leadership and initiative. These appropriations are an investment in the health and safety of community members of the 8th District and beyond, while also enhancing trust and transparency. These investments in body-worn cameras and co-response programs serve to highlight the King County Sheriff's Office work in traditional law enforcement, but as well as innovation and community partnership. They underscore our continual efforts to maintain our standing as a premier law enforcement agency. The Sheriff's Office has a history of law enforcement innovation. For over 5 years, we've been partnering with local jurisdictions on co-response programs. We know from our earliest work in Shoreline and Burien that co-responder models keep both communities and deputies safe while networking those in crisis with the services they need to thrive. And body-worn cameras are a cornerstone in our efforts towards ensuring we are equitable, just, and transparent in all we do. Everyone here today sees the cost to acquire, deploy, and support this proven tool as one of the best investments the Sheriff's Office and King County can make in enhancing public trust. The Sheriff's Office, in partnership with Representative Schrier and our 16 contract partners, including the City of Burien and the City of Sammamish, will continue to advance co-responder models, body-worn cameras, and other innovative community-centered solutions. Thank you. And now I will turn this over to Chief Ted Bowe.
Thank you very much. I'm Ted Bowe. I'm the chief of the Burien Police Department, also a major on the King County Sheriff's Office. I want to start out by thanking King County for our partnership and thanking Sheriff Cole-Tindall for really wanting to bring compassionate law enforcement to all of the communities that we're honored to serve. One of the things that we recognize in Burien is that we have to address both community conditions and individual needs. We can't ignore either one of those in how we respond. Public safety is a team sport, and we need to recognize that. We all have to be at the table and working collaboratively and collectively to get the results we need. One of the things I'm really appreciative is what's going on the ground in Burien. We have organizations like LEAD, REACH, Evergreen Treatment Services, so many others working in our community on the ground every day to try to meet the needs in our community. The addition of mental health professionals not only makes our police officers better, but it makes us better able to respond to our community. We partner them with EMS, and we partner them with law enforcement officers to respond to people in crisis in the community. So I am very grateful today for not only a great conversation we just had about how this should really look in our community, but also for the financial support to continue making these programs a reality and bring a right response to our community. Thank you so much. And I think we're available for questions, or are you back at that?
Thank you very much.
Thank you.
Thank you.
Congresswoman, what is there a timeline in Congress? I mean, I know it's all a moving target, but
Timeline is we are hoping for September 30th, and I'll keep you posted.
I think probably for the sheriff, in terms of the body-worn cameras piece, do we know about how many are already deployed throughout the office and how significant an investment this will be and how it fits into kind of overall efforts?
Well, currently we do not have any deployed. We did have a 90-day pilot late last year, which we were trying them out. We had about 10 officers that were trying them, and the pilot was a success. Our deputies want these cameras. The community wants the cameras as well. So we don't have them yet, but we've been working with the executive and his team through this next budget process to hopefully deploy the cameras sometime in the future.
is there a number on how many cameras?
We would, yeah, it would be for all of patrol. So we, my total complement for commissioned is 781, but that's not the number that would have cameras. I'm estimating when we're fully, probably like 600 would be wearing the cameras. But we would implement this. The implementation is going to be important, and it would be over time. We would do one precinct at a time rather than bringing everybody online on day one, because there's a number of elements. I mean, the public disclosure piece is huge, so we will need to make sure we are staffed up appropriately with our public disclosure officers, because the public, when you have cameras, certainly there is a large increase in requests for camera footage.
Anyone that wants to weigh in on this, are there any other policy pieces that need to be rolled out either at the county level or otherwise to actually bring these programs to fruition?
So I can just talk about in the sheriff's office. Yes, we will have to have policy, and we already do have a policy, and we are working with our labor partners because this is a mandatory subject of bargaining, wearing the cameras. So this is something that will need to be negotiated, and we are working on that now. But there is policy that we have drafted, and we believe it is meets the needs of the public and also our officers. And it's modeled after what I would consider model policy for cameras.
Other questions?
How is, and this is more a police officer, law enforcement question, but what latitude do you have now to get people who are clearly having episodes into treatment? There was a time when, there was no touching. How is that playing out now?
Sure. The current legislation does allow for an arrest for somebody in possession of narcotics, but it actually encourages us on mandates for the first 2 times that we actually do a referral to services. And one of the things I want to touch on that is it's important that we recognize that everybody's an individual in this world, and we want to be trying to give people the opportunity to get better, right? We want to minimize the use of the criminal justice system when it comes to somebody who has an addiction. But we also have to be responsive to that community demand, the community demand for how we manage our public spaces. And that's the balance that we're working with. After the second time, we can make a custodial arrest. So if we can document that they've had 2 referrals to treatment, we can use the criminal justice system in arrest format on the 3rd time.
And then what about getting people who are clearly in the midst of maybe even a severe episode to treatment? I mean, there are countless stories of, people that didn't get treatment, weren't taken to a hospital because at the time they couldn't. And how does that play out now? Is that where the mental health community that, collaborates with you guys comes in?
Right. We have to bring the right response to people. The reality is we can't take somebody involuntarily unless they're in immediate danger to themselves or others. So the fact somebody's in a crisis doesn't automatically allow law enforcement to take coercive action. Rather, what we try to do is get people out there in the field that can work with the person at moment of crisis, get them stabilized, and get the right response to them. But there isn't a law enforcement tool to somebody who's in crisis unless they're a danger to themselves or others.
Yeah.
You're welcome, sir.
That was, by the way, a hot topic of discussion in there, is how do you use the tools that you have to compel people to treatment? Because sometimes police officers feel like their hands are tied and that all you can do is offer a card. But that is where Susie comes in. And the reason that you can have a co-response is to have the right person who can not just hand a card and say, hey, when you're not high anymore, call this office for help, but to really close the loop, to follow up the next day, to really compel people into the treatment that will break the cycle. So thank you for asking that question. Are there any more questions? Good. Okay. Thank you very much for being here, and thank you again, Sheriff, Chief, Executive, and law enforcement, and Susie. Thank you.
Yeah. And if I could, Susie Kroll is a mental health professional who works with City of Redmond as well as King County Sheriff's Office. And I just want to make sure that if you have questions about how this co-responder model works or her experience in going out with police officers and helping to appropriately diffuse a situation, get person into treatment, she's the right person to talk to. She's the one with the experience in this. So thank you so much.
Questions for Susie?
Yeah, how generally does it work? Like, what is, a typical trip out? What kind of is the process like for you?
So I co-respond with a couple agencies, and I am dispatched with my partner to calls for service that have potentially a social services deficit or sounds like where de-escalation would be necessary. So the traditional ones like welfare checks, calls for suicide threats. I go to also low-level shoplifts also, because most folks that are stealing are usually needing of a resource. My partners make sure that it's safe for me to walk up because I'm just me, and I introduce myself and I say, hey, I'm Susie. This looks like a rough day. Is there something that we can do together that would make this better for you for today and tomorrow? And then long after that interaction, I'm still in contact with them until they get the resources or the stabilization that they need.
And have you seen some situations in which, you've really seen progress or been able to kind of walk that person through the steps they need to get the help they need?
Yes, I see the entire spectrum of folks that initially are very unwilling, all the way to the people that contact myself or my partners afterwards and tell me incredible success stories, from being actively suicidal on a bridge all the way to I'm in treatment and I'm able to see my children again.
So that means you're identifying them, getting phone numbers, contact information, and
Yes. And then doing those really warm, solid connections to social services within the community. So it's not just me saying, here's all your treatment, but here's the really great substance abuse folks, here's the really great mental health folks, here's a really great place to get job training. And then we make sure that that community policing is holistic and that they get their needs met, whether there's a criminal aspect to it or not.
And for someone who may be in the midst of a severe psychiatric episode, and maybe they do need to go someplace, how do you facilitate that, or can you facilitate that?
We can. I have to work within the same Involuntary Treatment Act RCWs that law enforcement do, where we look to determine if somebody is suicidal, homicidal, or gravely disabled. And then at that process, I provide an affidavit with clinical information to our local social workers and designated crisis responders. And they make the evaluation for that stabilization treatment for 120 hours or more.
One more question. What sort of, how quickly are you able to respond? They're debating this in
Yes.
Seattle right now.
Yes.
You have a situation, you send a police officer or a mental health specialist, you don't know, how do you come to that conclusion on the fly, and if after the fact they find out somebody like you is needed, how quick is the response?
So it really depends on the call type. I can be there at the same time law enforcement is arriving. I can be there afterwards. So I can also take referrals from officers that give me that paperwork after their interactions when I'm not working. So within the minutes of the 911 call, all the way to the spread of, hey, we were there this morning, you're in, can you follow up with them? It's been a couple hours later, all the way to, hey, you were on your days off, can you follow up with this person? So relatively quickly to whatever time frame the referral allots for.
And your last name?
Kroll, Kroll.
And your title?
I'm a mental health professional.
With King County, or?
I am a mental health professional with the crisis negotiation team for the sheriff's office.
I'm so glad that you all got to hear from Susie Kroll, because we called her the woman with the magic wand, and she was very humble about that. But truly, this is why this project is so important, because if you bring $1 million in for King County Sheriff, you can fund more Susies, who provide such an important resource to co-respond with police to make sure that all needs are taken care of and that we can keep communities safe. So thank you. Glad you got to hear from her.